Osilodrostat 10 mg tablet is used to treat Cushing's disease, which is caused by a tumor in the pituitary gland. This disease causes the body to produce too much cortisol, leading to symptoms such as weakness, puffy face, unusual weight gain, slow wound healing, thinning skin, bone pain, menstrual period changes, in women, mental/mood changes, such as depression, mood swings, agitation, easy bruising/bleeding, increased thirst/urination, and vision problems. Osilodrostat works by decreasing the amount of cortisol made by your body, helping to reduce these symptoms. The recommended daily dosage and the best time to take this medication will depend on your individual condition, so it's important to follow your doctor's instructions. Before you start taking Osilodrostat, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually twice daily. The dosage is based on your medical condition, response to treatment, lab tests, and other medications you may be taking. Your doctor may direct you to start this medication at a low dose and gradually increase your dose to reduce the risk of side effects. Use this medication regularly at the same time each day to get the most benefit from it. And don't forget to tell your doctor if your condition does not get better or if it gets worse. Some common side effects of Osilodrostat 10 mg tablet may include nausea, vomiting, diarrhea, stomach/abdominal pain, dizziness, tiredness, headache, muscle ache/pain, or loss of appetite. If any of these effects persist or worsen, it's important to talk to your doctor. Your doctor may adjust your dosage or advise you to stop taking this medication. It's important to note that this medication is prescribed because your doctor has determined that the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, if you experience swelling ankles/legs, fast/irregular heartbeat, severe dizziness, fainting, or symptoms such as swelling, increased blood pressure, or increased hair growth on the body, it's crucial to contact your doctor immediately. Osilodrostat may also cause a mild rash, which is usually not serious. But if you develop any rash, it's important to seek medical help as it could be a sign of a severe allergic reaction. Although very rare, a serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to remember that this is not a complete list of possible side effects. If you experience any other effects not mentioned here, it's important to contact your doctor or pharmacist. And remember, always consult your healthcare provider for medical advice about side effects. Before taking Osilodrostat, it's important to let your doctor know if you have any allergies, as this medication may contain inactive ingredients that can cause allergic reactions. It's also essential to inform your doctor about your medical history, especially if you have kidney or liver problems. This medication may cause dizziness, and using alcohol or marijuana can increase this effect. It's important to avoid driving or using machinery until you can do so safely. Limiting alcoholic beverages and discussing marijuana use with your doctor is recommended. Osilodrostat may affect the heart rhythm, which can lead to serious symptoms that need immediate medical attention. The risk of this condition may be increased if you have certain medical conditions or if you are taking other drugs that can cause heart rhythm issues. It's important to inform your doctor about all the medications you are taking and any existing heart problems. Low levels of potassium or magnesium in the blood can also increase the risk of heart rhythm problems. It's important to talk to your doctor about using Osilodrostat safely, especially if you are taking diuretics or experiencing conditions such as severe sweating, diarrhea, or vomiting. Before undergoing surgery, make sure to inform your doctor about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. It's important to note that older adults may be more sensitive to the side effects of this medication, especially regarding the heart rhythm issues mentioned earlier. During pregnancy, Osilodrostat should only be used when clearly needed, and the risks and benefits should be discussed with your doctor. It is not recommended to breastfeed while using this medication and for 1 week after the last dose, due to the potential risk to the infant. Consulting your doctor before breastfeeding is essential. When taking Osilodrostat 10 mg tablet, it's important to be aware of potential drug interactions. These interactions can affect how the medication works and may increase the risk of serious side effects. It's important to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. One product that may interact with Osilodrostat 10 mg tablet is fezolinetant. Be sure to discuss any potential interactions with your healthcare provider. If you or someone else has taken too much Osilodrostat 10 mg tablet and is experiencing severe symptoms like passing out or difficulty breathing, it's important to call for emergency help right away. In the US, you can contact your local poison control center at 1-800-222-1222. In Canada, you can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, low blood pressure, abdominal pain, loss of appetite, and fainting. If you suspect an overdose, seek medical help immediately. It is important not to share this medication with others. Your doctor may also require you to undergo various lab and medical tests, such as EKG, urine/blood cortisol levels, liver function, blood potassium/magnesium levels, and blood pressure checks while you are taking this medication. Make sure to keep all of your medical and lab appointments. If you forget to take a dose, take it as soon as you remember. If it's close to the time for your next dose, skip the missed dose and take the next one at your regular time. Do not take a double dose to make up for the missed one. It's important to store Osilodrostat 10 mg tablet at room temperature, away from light and moisture. Make sure to keep it out of the reach of children and pets. When it's expired or no longer needed, be sure to properly discard the product. You can consult your pharmacist or local waste disposal company for the best way to do this. Remember not to flush medications down the toilet or pour them into a drain unless instructed to do so. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.